In this video, I want to talk all about what does Selma, Blair, and Selena Gomez both have in common. Both of them are battling an autoimmune condition and being treated with harsh chemotherapies and drugs to suppress an overactive immune system. Selma Blair being diagnosed with MS and Selena Gomez being diagnosed with lupus. Both have an immune system that is attacking various parts of their body, and it's influencing the way that they work, their social life, their personal life, and even how much pain they're experiencing on a regular basis. And these meds that they're using are so harsh that can influence even how their body is fighting off other infections and what they're more prone to down the road. My name is Dr. Lori, and I want to deep dive into both of these scenarios and what these women can do to help support their immune system without causing so many side effects and taking more of a metabolic approach of why this disease process happened in the first place. And always remember that the name of the disease is not necessarily the cause of the disease. So for many, many years, there needs to be things off in your own body's biochemistry in order for this pathology to happen. So with MS, for example, what is overstimulating that immune system to destroy the myelin sheath around the nerve cells and affecting how your body is communicating? And same with any autoimmune condition, even with lupus. What is overstimulating the immune to not recognize itself as healthy and normal and to go into that attack mode? That is the real question we need to be asking, instead of just suppressing these symptoms, anything that your body's trying to express. And I can understand from a very successful professional mentality where these women, just their livelihood is being in front of a camera and they need to perform a certain way, and if they are not ready to go on screen, then they are losing income, they're losing their livelihood, and so many other things are affected. And I feel like that's a very common mentality overall, where someone would say, just give me the medication that I need, tell me what I need to do so I can just carry on with my life. And I feel like this is a learned helplessness that many of us have had growing up. You go to the doctor, you get the pill, and you carry on. You don't really necessarily look at the body as, what is it trying to tell me? What are these symptoms trying to tell me that's out of whack, and how can I rebalance? So for example, I have many patients who have been diagnosed with a critical illness. They go to their doctors and they just get pain medication, or they get antidepressants. They get 3 other medications as a side effect of the one main imbalance that they're experiencing. So you think about every medication that has a side effect, you're just adding layers and layers to that underlying reason why there's an imbalance in the first place. And that is not how your body heals. So in this video, let's go through what can trigger an overactive immune system and what are the many things that you can do to help rebalance that immunity without suppressing it altogether. There are 3 main things that I've seen in my own practice that are very common to be triggering how your immune system recognizes your healthy cells. If you haven't already, you can go back and check out the videos I've done on mold, because these mycotoxins, the spores that are released from the mold, can drastically impact how your immune system is regulated and create a dysfunction leading to autoimmune conditions. And the reason why this happens is because these mycotoxins stimulate your TH1 immunity. The other 2 very common things that stimulate TH1 are diesel exhaust particles, also a depletion in glutathione, which is our body's antioxidant and the way that we support and reduce inflammation in our system. So when there's too much oxidative stress, that can drastically stimulate this TH1 response, which is directly correlated with this autoimmune response. If you're looking to have a deep dive to understand why your immune system is balanced, to have chemicals tested, mold tested in your body to see if there's any chemicals or exposures to things that could be creating more inflammation and confusing your system, make sure you go to drlori.ca, where we can take a deep dive, a thorough assessment of understanding you and your body and your unique needs of what needs to be balanced for modulating your immune system. So after we get these tests back where we see, okay, you've had mold exposure, your blood work is showing high oxidative stress, high ESR, you have a fire going on in your system where there's just way too much inflammation. So what's next? And this is where I want to go into the top 5 things that I like to do for balancing that TH1 TH2 immune response. The other thing that's really interesting is if your TH1 is overexpressed, these are the type of people that generally don't get sick. So when they are diagnosed with something, you think, I don't understand, I'm hardly ever sick. My body was just so healthy for all these years. How did I end up with this XYZ diagnosis? But the reality is, to get sick once in a while is actually not a bad thing. But if you have an overexpression of this TH1, then your immune system is in overdrive constantly, and you're more prone and more likely to have an autoimmune disease. Other than following an anti-inflammatory diet or a diet that's more specific for autoimmune conditions, my top supplements that I like are ones that also bring down inflammation and modulate your immune system. And those include curcumin, fish oil, boswellia, resveratrol, and EGCG from green tea. And because our body is filled with cannabinoid receptors, CBD has actually been shown to have a regulating effect on the immune system as well. It's an anti-inflammatory compound that you can get in an oil, just making sure that the source that you're getting is very clean, because that is something that you can talk to your integrative doctor and integrating into your plan on a regular basis. Now, if you're taking these agents and hoping to have an anti-inflammatory effect, it's really important that you get your blood work checked regularly and eliminating the reason why there's inflammation there in the first place. So you could be spending a lot of time and money on bringing down inflammation, but if you haven't gotten rid of the mold exposure, or you're still going to work and breathing in this exhaust and doing other things that create more oxidative stress, like working out too much or not getting enough sleep or having a diet that's not anti-inflammatory and just creating more stressors on the system, then you're really just going in circles. Make sure to check out the next video where I go through wellness wisdom from Christina Applegate, who's not only had an autoimmune condition herself, she's also had a breast cancer diagnosis. So thank you for watching, and make sure to check out the next video.